Good morning.
Recording started.
We are now 17 days out from the January 12th earthquake that crushed Haiti. The situation on the ground continues to evolve and change, and medical teams are reporting a big shift over the last few days in the types of cases they are seeing. We've seen a substantial drop in the trauma cases. Needs have shifted towards the care of those post-traumatic survivors. Reports indicate that there have been over 2,000 amputee cases. All these people will require follow-up care, and we will work with other organizations such as Handicapped International in planning long-term actions to treat the wounded and support their recovery. This week, PAHO WHO added 6 tents near the PROMES compound for post-surgical care that will be operated by Médecins Sans Frontières, Spain, and 2 more to a post-operative care site on the grounds of the organization Love a Child in Font-Peresson to accommodate patients recovering from surgery. We are concerned about the high concentration of people living in resettlement camps under very precarious conditions that are ripe for a scourge of infectious diseases. We will continue to work closely with partners and the Ministry of Health to prevent and control these diseases as we reestablish and improve health services. To maintain effective surveillance for communicable diseases, the Ministry of Health, PAHO WHO, and CDC, Canada, Cuba, and other UN partners are setting up an emergency surveillance system in Haiti with a situation room where national and international partners can monitor and investigate cases and the data they collect and provide information to decision makers for appropriate actions. With respect to measles, endemic measles virus transmission was interrupted in Haiti in the year 2001. From November 2007 through November 2008, we also had a catch-up campaign against measles and rubella, targeting the age group 1 to 19 years of age with vaccine against these diseases. Polio vaccine was also added for children aged less than 5 years. Subsequent surveys indicated that approximately 70% of the targeted populations were vaccinated. The risk of measles, particularly a measles outbreak, will depend on the reintroduction of the measles virus into the population of Haiti. Therefore, we are insisting that all aid workers going to Haiti should be vaccinated against both measles and rubella to prevent any well-meaning volunteer who is not immunized from bringing measles or rubella into the country. We know of one suspect measles case that was reported in Port-au-Prince, but the investigation revealed it was a case of chickenpox. This is excellent news because it demonstrates that the system is looking for infectious diseases, it's working, and it's following up with the necessary epidemiologic investigations. We are not recommending a national mass vaccination campaign at this time because it would divert valuable resources from urgent care and other life-saving activities necessary as we speak. However, we will reconsider once vaccination becomes logistically feasible and the situation on the ground stabilizes. High concentration in confined resettlement areas with poor sanitary conditions and low coverage before the earthquake requires urgent but targeted vaccination strategies. PAHO WHO is supporting Haiti's Ministry of Health, doing everything possible to ensure that this can be done. Cold chain, distribution, and deployment of vaccines continue to remain as challenges that we are working collectively together to overcome. Planning and organizing activities with local partners have already begun. These plans consider immediate, short-term, and long-term interventions. Priority age groups, particularly children less than 5 years of age, will be targeted first for vaccination. A pilot effort in one or more settlements next week with PAHO WHO, UNICEF supporting the Ministry of Health will be done using vaccines against diphtheria, tetanus, whooping cough, measles, and rubella. Restoring clean water and sanitation systems that were damaged during the quake is still a top priority for the health cluster. There's a critical need to improve environmental conditions in the hundreds of temporary settlements where people have congregated. All this will be particularly important as the rainy season approaches, usually in April. To that end, PAHO WHO is working with Haiti's National Water Authority, DENEPA, and other partners to chlorinate water in collapsible tanks that are supplying to these temporary settlements. Meanwhile, the National Water Authority, DENEPA, is delivering water to some 300,000 people through 133 distribution sites in the metropolitan Port-au-Prince area. And other partners are expanding into areas including Léogâne and Jacmel. On the sanitation front, there are nearly 36 organizations in the UN-led water and sanitation cluster that are building latrines and handling solid waste disposal. To complement these efforts, PAHO WHO is developing hygiene messages for disseminating to the public. PAHO WHO's ProMess, the medical warehouse located at the Port-au-Prince airport, continues to provide medicines and supplies to hospitals and medical teams in Haiti. PAHO WHO staff are continuing to assess the real-time needs for these supplies. Based on these assessments, we track and deploy a supply of medicines that are urgently needed at any one time. Currently, the priority needs include, among other things, antibiotics, bandages and gauze compresses, exam and surgical gloves, catheters, and urine collection bags. In addition, we have deployed more than 525 units of blood. Yesterday, we received a shipment of 350 units of blood from the American Red Cross. Potential donors can see the full list at paho.org/disasters or on the who.int website. One of the lessons we continue to learn over and over with each disaster is that not all donations are effective donations. In the case of Haiti, we have seen once again that if donations are not based on identified needs or are not well coordinated, they can be ineffective and in some cases even do more harm than good. We know that aircraft have arrived with unsolicited goods without any provision for their storage or distribution. Because of the earthquake's disruptive effects on transportation, communication, and the activities of the government, and a host of our organizations already working in Haiti, it has been enormously challenging to receive and distribute aid in any efficient way. We would like to remind all well-intentioned volunteers that before traveling to Haiti, they should check with their agencies or groups with whom they will be working to ensure the necessary accommodations, communication, and security are in place to make their efforts useful and effective. We must avoid diverting any resources intended for the care of the Haitian survivors. As I mentioned, the hundreds of spontaneous settlements, approximately 600, where people have congregated have very precarious living conditions. Food safety and clean water are major issues, but people living in these conditions are also vulnerable to outbreaks, environmental hazards, including the weather, especially the rainy season as it approaches, and violence, particularly against women and children. On that latter issue, the United Nations Stabilization Mission in Haiti, MINUSTAH, is working with agencies such as UNIFEM, the International Red Cross, and the UN Population Fund to raise awareness about sexual exploitation and abuse. Finally, PAHO and WHO have clear guidelines to be a good donor. These guidelines are available on both the PAHO and WHO websites that I mentioned. In general, the most effective way to help after such a disaster is making a cash donation to a reputable organization that is already on the ground in the affected country. That said, we recognize that medical supplies and medicines are usually in urgent demand following disasters. But again, it is critically important that they be provided based on the actual needs. PAHO WHO's guidelines on drug donations emphasize that they should always be based on the express need and should not be sent unsolicited. Donors who want to give medicines should respect the wishes and authority of the receiving country and should make sure that their donations actually support existing health policies and administrative arrangements. We should reinforce to the extent possible that there should never be a double standard with donations, particularly about quality. If the quality of an item is unacceptable in the donor country, it is also unacceptable as a donation. Good communication and coordination between the donor and the recipient on the ground is absolutely critical. PAHO WHO is working to do this with its LSS SUMA system, a system for managing humanitarian supplies. It is operated out of our ProMess warehouse, coordinating the acquisition and distribution of donations and other supplies received through the Port-au-Prince airport. These efforts help ensure transparency and efficiency as we attempt to track what goes where. With that, I'll end there and entertain any questions. Thanks again for coming.